For heart disease, what matters is, do you reduce your risk of having a cardiac event? We have plenty of data now on plant-based diets, whether predominantly or strictly plant-based, and reduction in risk of cardiovascular disease, whether in primary or secondary prevention. That's what matters. Weight loss is probably the most powerful tool for treating type 2 diabetes with diet or lifestyle. And so any diet that can lead you to losing weight can, put you into remission if you lose enough weight. And particularly that around your organs or in your organs. People don't like to hear that in the plant-based space sometimes because they kind of want the plant-based diet to be the only answer, but hey, it's an answer. And I think that's huge. A meta-analysis published in 2017 found that vegan diets were associated with a 15% lower risk of developing cancer. I would never tell a patient to avoid medical care, just make the dietary change to treat their cancer. That'd be ridiculous and very unethical.
Hello everyone, welcome back. Today I'm joined with Dr. Matthew Nagra. He's a plant-based doctor from Vancouver. I've been following Matthew for quite a while now, learning a lot from his evidence-based information. I really got a lot of respect for Matthew when I was listening to an Instagram live he was doing with Science by Jay, and you were probably the first plant-based nutritionist who came out and said low-fat, dairy and fish are perfectly healthy foods. You're not one of these people trying to push an agenda. You're just saying the facts how they are. You just said, yeah, they're perfectly healthy foods, but they're not ethical. You're a naturopathic doctor. And so on the internet, you hear all sorts of different interpretations of what this means. Let's talk about how you became vegan. I think it was from your personal trainer, and then how you got into naturopathy.
For starters, I didn't know that's actually how you came across me from that live I did, because Jay was obviously transitioning into a vegan diet and had questions, and so I was like, let's just talk about it. And it was really good. I think we've stayed in touch a lot, and he's definitely making that shift. As far as my own story, when I was younger, I had some health issues, health concerns. I always struggled with my weight. I had seasonal allergies. Sometimes they'd be quite bad. I definitely had asthma that at points was quite severe as well. And I had a personal trainer when I was training for football, American football. I also played soccer, and I've done that through my whole life. But when I was playing football, I was training with the trainer, I think a couple times a week. And he really promoted a more plant-based sort of diet. Maybe not even strictly plant-based, but definitely heavy on the plants. He was very anti-dairy is one of the things I remember. And so, he wanted me to record everything that I ate for a couple weeks, like a food diary. And I was just thinking, my diet is so bad that he's going to see this. And, I'm already struggling in the gym. It's already hard enough. How much harder is he going to make it on me? So I was like, I'm just going to eat according to his recommendations for a couple weeks. And I didn't lie about what I ate. I actually changed what I ate for those couple weeks. And I started feeling better. Within those couple weeks, I lost some weight. My skin was clearing up. I felt like I was breathing easier. I started noticing, and obviously this is anecdotal, and we'll talk maybe more about that later on, but for myself at that young of an age, in my early mid-teens, that was huge for me. And so I stuck with it after that time. So I hadn't had, or I'd eliminated basically most of your ultra-processed junk foods. I'd eliminated dairy. I'd reduced my meat intake. I was eating way more fruits and veggies, lots of smoothies, things like that too. And I kept that up for a period of a couple of years thereafter. And then eventually when I got to university, I started to maybe slip the other direction a little bit, eating cafeteria food, drinking on the weekends with my friends and that sort of thing. And there was a point in my second semester, actually, the anniversary of that date will be in about a week and a half from now. So it'll be 12 years in a week and a half. I just said, you know what, I'm feeling crappier. I know how I used to feel, how much better I felt. And I'm just going to go all in 100%. And this was after I had, seen things like Earthlings as well, which might have further supported that decision to go 100% plant-based. And so I did it overnight, February 24th, 2011. And at the time, because one thing about my trainer was it wasn't just plant-based diet, he was very into raw foods. So I went more that route at the beginning, which again, I'm not the biggest supporter of nowadays, but I started kind of in that realm and then eventually rounded out my diet more into, what I would consider a very healthy, well-balanced, vegan diet. But that is sort of the transition and how it happened over the course of, I think it was probably 3 years or something from that first incident up to when I went 100%. When I was in school, I took nutrition classes. I took some just they had various sorts of health and wellness classes at my university, some around physical activity, some around public health. And one of my instructors for one of those classes actually saw a couple naturopathic doctors. And I was always interested in kind of the healthcare field, but given my own experiences, I did want to go into an area where I could not just work on the medical side and use medications and all of that as well, but I wanted to do something where I could really focus on diet and lifestyle. And so she actually recommended, hey, why don't you shadow them for a couple of days? And so I did. And I started learning, wow, they have a lot of access to things. I had these preconceptions that it's largely anti-medicine and that sort of thing, which I think is very prevalent. But no, here in BC, and I'm not going to speak for everywhere around the world. There are places where it's not regulated. There are places where the regulations are different. But here in BC, we can prescribe medications. We can send for blood testing. We can do a lot of what a primary care provider may do. And actually, we are considered primary care here. So it was a little bit different than what I think a lot of people would suspect. And so that got me interested. And then, I was still kind of wrestling with what exactly I wanted to do. And I decided, I'm going to be a student for a day. They'd had this sort of student for a day trial thing at the school where you can kind of sit in on some classes, speak with students. And I did that. And I sat in on one of their anatomy classes. And their knowledge around like physical medicine, physical therapies, and that sort of thing being within the scope. Again, another thing I wasn't super familiar with, or familiar that it was included in their scope. It just really impressed me. And I thought like, wow, I could even do some of that, which is certainly a little bit of my practice. And so that is kind of when I made the decision. It was about my third year of university that I wanted to go this route. And throughout my education, I say there's been, and into practice, there's been points where I'm, disillusioned a bit maybe, or disheartened with the profession. And then there's points where I'm really happy with at least what I'm doing. And what I do is essentially, guideline-based medical therapy where applicable. And then I incorporate as much of the, diet and lifestyle counseling as possible, largely nutrition-based. And I'm really happy with that. And I think there are things that are within our scope, like energetic medicines or whatever you want to call them, like that stuff to me needs to go out. That is our Achilles heel in my view, where it's what people are really going to point to discredit what we can do. And ultimately there are people like myself in the profession who I think are really taking more of an evidence-based approach and kind of melding the medical therapies with more of the lifestyle-based therapies. And then there are those who are focusing solely on that kind of other side that are maybe hurting the profession a little bit.
First time I heard of you was not with Science by Jay. It was a previous podcast with Simon Hill, The Proof, where you did the debate. If we look at the main chronic diseases, cardiovascular disease, diabetes, cancer, we hear a lot on the media. There's a lot of big claims. Yeah. Some people say the plant-based or vegan diets can reverse heart disease as well as diabetes. From what I've been getting from the literature is that it can reverse diabetes, but it's not the sole diet which can. And with regards to cardiovascular disease, it can reduce risk, but not reverse cardiovascular disease. Is this correct?
There's a couple things I would maybe tweak there. So for diabetes, let's start with type 2 diabetes. I've moved away from the term reversal on that. I tend to use the term remission now, and I've seen that used a lot more in the kind of endocrinology sphere as well. And it's because there are certain things that maybe aren't reversed. For example, you might have microvascular damage from diabetes that won't necessarily be reversed. Potential for some beta cell damage in your pancreas, which might not be reversed. And then there's the issue of you probably have to maintain that dietary change and ultimately your body weight to maintain remission, so to speak. It's not like you can go back to doing whatever. So I would move away from the term reversal a little bit on that. But it's also not necessarily the plant-based diet that's doing it. It's actually weight loss is probably the most powerful tool for treating type 2 diabetes with diet or lifestyle. And so any diet that can lead you to losing weight can put you into remission if you lose enough weight, and particularly that visceral fat around your organs or in your organs. And, people don't like to hear that in the plant-based space sometimes because they kind of want the plant-based diet to be the only answer. But hey, it's an answer. And I think that's huge. And it can be for a lot of people, for people who can end up losing a fair amount of weight on that diet. Now, if you're in a calorie excess and you have excess body fat, there might be differences between certain types of fats and their impact on insulin sensitivity. So like saturated fat might be worse than mono or polyunsaturated fats. And we have controlled feeding experiments there. So there is a little bit of nuance there. And perhaps that's an area where a plant-based diet can be preferable to a more, say, animal-based diet. But yeah, by and large, weight loss is what drives that. As for heart disease, so the idea of reversal comes from typically a couple studies. There was a case series by Dr. Caldwell Esselstyn where he took a bunch of people, put them on a strictly plant-based diet, and he performed some angiograms, and he has the famous picture where the artery looks like it's really like barely any blood flow through it in the one image, and then the other one you have a full open artery. For one, that's a individual. Whether or not that's due to the diet, we don't know. It's not a controlled trial. It was just someone who was placed on the diet and may have had that happen. But the other issue is with the imaging they used, different angles, like even slightly different angles in the image can lead to, pretty drastic differences on the actual picture there. So hard to say for certain that that was reversal. The other trial is the Lifestyle Heart Trial by Dr. Dean Ornish. So in this trial, he randomized participants, I believe it was 29 participants, to a low-fat vegetarian diet. They also worked on stress management, smoking cessation, although only, I believe, one person smoked at baseline, so it's probably didn't have a huge impact. They walked primarily for exercise. They took a B12 supplement. They attended support groups. So it was more than diet, and it wasn't a vegan diet. It was a vegetarian diet where they could have egg whites and low-fat dairy as well. And then there was the 20 people in the control group who underwent standard cardiologist care. Now, the participants in this trial had confirmed coronary artery disease, or at least I think it was based on angiography. They had some plaque development in their arteries. So you knew that for sure. And then they performed quantitative coronary angiography to see how much the plaque volume might have changed. And there was perhaps a bit of a change, but it didn't meet what's called or considered the threshold for a clinically significant difference. It could just be a difference of measurement error, or it could be that the lumen of the artery expanded, right? So if you have an artery that's this big and you have plaque building up here, but then the artery is just a bit wider, it can make it look like the plaque is smaller when it didn't actually get any smaller. And that's one of the issues with that trial is it seems that the reference got larger versus the plaque getting smaller potentially. And so not strong evidence that we saw a reversal there, but at the end of the day, it doesn't matter. That's the thing. It really doesn't matter. What matters is, do you reduce your risk of having a cardiac event? And if you look at the 5-year follow-up in that trial, the control group had 2.5-ish times the risk of having a cardiac event. We have plenty of data now on plant-based diets, whether predominantly or strictly plant-based, and reduction in risk of cardiovascular disease, whether in primary or secondary prevention. That's what matters. And if we can do that, who cares if the plaque gets bigger if you have a lower risk of heart disease, right? Or actually having a heart attack. That's what matters.
The trial you mentioned before, the Ornish trial, was that completely vegan?
The Esselstyn one, yeah, I believe that was strictly vegan. But like I said, it wasn't really a trial. It was just a series of like 198 patients, I think. And then they had some people drop out because perhaps the diet was too difficult for them to follow. And then they kind of compared rates between those who were compliant and those who weren't. But obviously there are so many confounders there when you're comparing people who are compliant with an intervention versus those who aren't. And I believe a lot of them were taking statins as well. So it wasn't even just the diet. So yeah, there's a lot of issues with using either of those to just claim that the diet reversed the disease.
With regards to the remission of diabetes, there was a super interesting paper by the Canadian Journal of Diabetes. As you said, it's driven primarily by weight loss. If someone has diabetes of normal BMI, does that make it more difficult for them to get remission?
Yeah, so that's actually a really good question. So one of the things with type 2 diabetes is, or one of the big kind of hypotheses is that there's a fat threshold. So different people will have a different threshold at which they develop insulin resistance and type 2 diabetes. And so some people, that might even be within a normal kind of range, or what's typically a normal range. For people of South Asian descent, like myself, we tend to store more body fat as visceral fat, and therefore have potentially lower fat thresholds. So yeah, in those cases, it becomes an even bigger problem. And I mean, obviously medications are available too to help control it, but in those cases, perhaps even being on the lower end of what's considered normal would help. But obviously that's something that each individual would have to speak with their healthcare team about.
When you refer to visceral fat, for people who are not aware of this term, this just means belly fat, right?
Yeah, it's like fat that's sort of surrounding and within your organs. So that's really, you think of like liver fat, for example, that really contributes to insulin resistance in the liver because that's one of the organs that really takes up a lot of the glucose.
Moving on to the next chronic disease, cancer. Also, we hear lots of anecdotes. Have you seen any nutrition be able to reverse cancer?
No, cancer is such a complex disease for one, and no, you're not, at least with confidence, you're not going to be reversing cancer with diet. But that doesn't mean that diet doesn't play a role in cancer. What we do know, though, is that from a preventative standpoint, plant-based diets do tend to be protective. Vegans and vegetarians do tend to have lower risk. A meta-analysis published in 2017, lead author was Monica Dinu, found that vegan diets were associated with a 15% lower risk of developing cancer, and I believe the vegetarian diets were associated with an 8% lower risk to meat eaters. And this is consistent with research on diet quality. So diet quality indices that generally positively score plant-based foods and negatively score animal foods or ultra-processed foods, or at least certain animal foods and ultra-processed foods. They tend to be associated with lower risk as well of developing cancer. As far as treatment or in people with cancer, I mean, we have a bit of research on certain markers of diet quality and recurrence of cancer or mortality in those with cancer. We actually have some research on like soy consumption and breast cancer recurrence or mortality in people with breast cancer diagnoses. And this seems to have a protective effect there, at least based on the evidence that we have. So I'm not going to say diet doesn't play a role. Absolutely can play a role. It's just that these claims around completely reversing or curing cancer with diet are way overblown.
Where you work, have you ever had any case studies where this has happened?
I mean, I don't think I've had patients who solely made dietary changes but avoided the medical care. So it's always been in conjunction with medical care, and whether it has an additive effect, I mean, I wouldn't be surprised, but I wouldn't say that I have any cases where I can point to, it was the diet for sure, because I mean, I would never tell a patient to avoid medical care and just make the dietary change to, treat their cancer. That'd be ridiculous and very unethical.
We've talked a lot about anecdotes. If we just go back to the literature, so epidemiology, someone sent in this question. I know you had a debate whether causality can be proved through epidemiology. Could you briefly describe what is epidemiology and how can you determine causality?
Epidemiology is actually the study of the distribution, prevalence, and modifying factors for disease. So it can actually encompass both observational research and randomized controlled trials. The funny thing is, it's always used like colloquially to refer to observational research, but I just want to put it out there that epidemiology actually encompasses randomized controlled trials. Now, when we're referring to observational research, what you're doing, and there are different ways to do it, but typically with nutrition, we're looking at prospective cohort studies. Those are kind of the highest here. You enroll a bunch of people at a given point. If we take like the health professionals follow-up study, for example, or nurses' health studies, so we're talking about enrolling people in the 80s, maybe even the mid 70s, and then you collect their dietary and lifestyle and health information at baseline. You follow them up for years. At this point with those studies, it's like 30 plus years. And then throughout that time, people are going to have heart attacks, they're going to develop cancer, they're going to develop diabetes, etc. And you track all of that, and then you see if there's an association between certain variables like diet quality, vegetarianism, whatever, and that outcome. But what you also do is, or what you can do is with those studies, they repeatedly collected diet data and lifestyle data every 2 to 4 years. So you actually know if they changed. Because one of the issues with observational research sometimes is you only collect it once at baseline, then who knows if they changed throughout the follow-up, right? So with that study, we have really good data. And then you adjust for confounding variables. So you don't, let's say we want to look at high plant-based diet scores, plant-based diet index scores and cardiovascular disease. You will look at how closely the plant-based diet scores interact or correlate with the outcome, but then you're also going to look at how smoking status, how physical activity, how family history of cardiovascular disease, all of those factors correlate with the outcome too. And then you're going to statistically remove those from impacting the result between the plant-based diet index and the outcome. So you're essentially comparing people who would be similar in those other characteristics. So you're leveling the playing field so you can kind of tease out specifically how much did the plant-based diet index score impact risk. And so it is a lot like, randomized controlled trials in that you're essentially looking at the association between this single variable, or at least trying to, and the outcome over a period of time. And that's really what inferring causality boils down to. You need obviously an association, you need temporality, you need to know that the exposure or the intervention came first. And then are the results reproducible? Do you see this in different populations? Has it been repeated? And if you have all of those things, I think you can reasonably infer causality. And that's actually, those three are something I got from Nick Hebert, a Nutrivore, who I know you've had on, because that's really, I think it makes the most sense out of the different sort of criterion you can put out there.
Have you heard of the Bradford-Hill criteria?
So it's not a criteria. That's the thing. Everyone refers to the Bradford-Hill criteria as a criteria. It's not. They were Bradford-Hill's viewpoints. That is what they originally were. I don't know how it's become this like checklist. And within that, there are 9 domains. There's strength, so the strength of the association, and basically it's the suggestion that larger risks or larger associations would be more likely to be causal. But what if something is causally associated with a 10-15% increase in risk? That's totally possible. Does that mean it's not causal? No. So it's not a criteria that you need to hit a certain threshold. It's just perhaps in some cases it might be more likely if it's larger. Consistency, I kind of mentioned that with the reproducibility, like you want to have consistent findings. This is one that actually Bradford-Hill himself in his original paper said that shouldn't be overemphasized, and that's because you can have multiple exposures lead to the same outcome, or you can have a single exposure leading to multiple outcomes. Smoking, for example, can increase risk of lung cancer as well as heart disease, as well as other outcomes. And obviously multiple things can cause lung cancer and cardiovascular disease, et cetera. So specificity is not super important. Temporality, I mentioned that, absolutely. You need to know what came first, right? You can't have, people have a heart attack and then they adopt a vegetarian diet. Obviously the diet didn't cause the heart attack. I mean, it makes sense. Biological gradient, with a dose response, I think that's fair. More likely to be, or I would say more likely to be a causal association if you see increasing risk with higher doses, or you see a risk at a specific dose, then that is consistent across research. Plausibility, do we have mechanisms that we can point to potentially causing that? Coherence is it consistent with other data? Kind of already mentioned that. Experiment, do we have experiments to suggest that this association exists? Which again, we have that for with nutrition largely on biomarkers a lot of the time. So we'll have like dietary interventions that might increase LDL cholesterol or blood pressure, or do the reverse, reduce them, and those might lead to outcomes. And then analogy is like, can we see similarities between this current association and other exposure disease associations as well, that where we can maybe infer causality. And so there are those 9 criteria or viewpoints more specifically that are often used as a checklist. And just as that quick rundown, you can kind of see that some of them are more important than others, and they might help establish whether or not an association is causal, but by no means do you need all of them to be there to establish causality, or to infer causality, I should say.
What is your position on this question? Do you believe that you can determine causality 100%, or is it more related with probability?
Oh, it's all about probability. You can't ever prove something 100%, but we can, at a point, we can reasonably infer that the association is causal, and that's really it. And if we don't have if the data is super consistent, we don't have a good reason to doubt those results, then yeah, we can, I think, reasonably infer causality. And what's really funny about these sorts of questions that you get or concerns that you get is, these are from people who usually consider randomized controlled trials to be the gold standard. Now, there are issues with conducting long-term randomized controlled trials in nutrition because who's going to stick to a dietary intervention for 10, 15 years? I mean, it's not very common. It's not something you're going to see a lot of. But when we look at the concordance, so how closely epidemiology, or sorry, I shouldn't use that because I just explained why, observational research agrees, at least to a reasonable degree, with randomized controlled trials, we see that when you're looking at dietary interventions specifically or dietary patterns specifically, they agree about just over 90% of the time. So if randomized controlled trials are the gold standard and the observational research is agreeing, 90 some odd percent of the time, it's pretty good. I don't see how you can really argue that.
But thanks for making that distinction. Epidemiology includes RCTs, randomized controlled trials. That's important, just so we're aware of the difference. Thanks a lot for tuning in. This was the first part of our interview with Dr. Matthew Nagra. In the second part, we will have a look at optimizing vegan nutrition. We will look at whether vegans are at risk of bone fractures, choline deficiency, depression, and much more. We will also learn about whether eating based on your blood type is fact or fiction. If you only listen to this episode, please check out the video on YouTube as it has got plenty of references. You can support Foolproof Mastery in a number of ways. First of all, please subscribe to our YouTube channel and leave a review on Apple Podcasts with an honest opinion of what you think. Leave plenty of comments on YouTube and share with your friends, family and colleagues if you feel that you have learned something new in order to keep on getting the knowledge out to as many people as possible. Finally, keep on living every day to the maximum and see you next time for another episode. Ciao.